Buongiorno, io sono Andrea Guzzetta, sono un neuropsichiatra infantile. I'm just kidding, I'll talk to you in English about general movements. Children with cerebral palsy experience brain damage around birth or before birth, and so the language of their brain, in other words, the way they will move, will be different from typical movements. And so by looking at their movements, we will understand that there is something that is wrong in the brain. The general movements are movements we all do when we are infants, spontaneously, and all babies do that. And they are the result of the brain that is functioning. So when the brain works and we are just born or even in the uterus, we move. And so if we learn how to read these movements, to understand and to interpret, we are putting a little bit of a window inside the brain of these babies. So if we understand how normal movements occur, we can understand that in these babies the movements are less rich, are less variable, less complex. So overall is a technique that is very straightforward. So it is very important to detect cerebral palsy early for several reasons, but the main one is that we want to intervene as soon as possible. The general movements is a very reliable technique, and there are now many studies that have shown that is one of the most powerful methods to predict cerebral palsy. It's probably the most powerful among the clinical methods. The general movements technique that is easy to be learned, it's straightforward, can be shared by experts. Of course, needs some training, but it can be easily implemented.